Hi there, my name is Nicole, Hebert with the Journey to Hope team, and this is Voices of Recovery.
Thank you very much for having me speak in regards to paramedics. And my name is Sereda, and I am an advanced care and community paramedic with Medavie Health Services West. So how we kind of fit into the addictions piece and how we support individuals within our community is we're very blessed to have Medavie and to build on their mission, which is really to improve the well-being of Canadians. And so our new community paramedic program here in Moose Jaw does just that. So we collaborated with the Saskatchewan Health Authority, and our new community paramedic model is a connected care model where community paramedics provide medical support and treatment, as well as resources in a community-based setting for individuals who are experiencing mental health issues and substance abuse disorders. So this is actually the first of its kind in the province, and this type of model, as well as I believe it is the first type of model nationally within Canada. So we are pretty excited in regards to where we've come in such a short amount of time. So since the inception of this program in April of 2021, we have been able to connect with over 150 individuals within our community and have been able to also provide over 450 follow-up visits to these individuals who are experiencing substance abuse or mental health disorders. So our follow-up visits includes things such as medical supports and monitoring, home detox supports, transportation to medical and detox facilities, vital sign monitoring, administration of medications, mental health supports, wellness checks, as well as connecting and consulting with physicians right in the individual's home. Referrals into our program can come from outside agencies. So we have been really blessed to work with a great collaborative team within Moose Jaw. There's a lot of supports within our community here that really work together as a team for that patient-centered care that we all want to provide. So referrals can come from the emergency department, mental health and addictions, Moose Jaw Police, as well as their police and crisis team, family physicians, Waccamaw Detox, and any primary healthcare teams can also provide referrals into our program, as well as internally our paramedics as well. If someone does access the 911 system, they can actually refer those individuals into our program so we can follow up with them and ensure that they have the right resources in place. So, further to once individuals are connected to our program, we're actually able to connect them even further. Again, we are more of a short-term resource for individuals, even though once someone is in our program, they're always going to be in our program, as we actually just, follow up every few weeks later just to see how they're doing and doing wellness checks with them. So we're actually able to connect individuals if they have never been connected with mental health and addiction supports. We can actually refer them directly to them. We have connected many individuals to family physicians who have never been connected with a family physician. So we were able to get them the medical support that they are requiring, as well as connecting them to our local Waccamaw Social Detox and getting them into that process as well. And really just helping navigate through the healthcare system as it becomes very daunting at times for most individuals, but individuals who are experiencing mental health or substance abuse disorders can also find it extremely confusing, and then they just want to just kind of give up and don't want to pursue that. So we're actually there as a support for them as well for that. So individuals within our community. So as a paramedic of myself of 25 plus years, as well as a community paramedic, and now as a leader today, I really try to instill in my team members that every day we have the opportunity to impact someone's life. And it really doesn't have to be anything big. It can just be something very small. And I recently sent a message out to our community paramedic team stating, speak to people as if all you see is their potential. Not everyone gets someone like that in their life, and be that somebody. So it's really important when we are accessing and assisting individuals with mental health and substance abuse disorders that sometimes really we just need to listen and also provide them the opportunities that they may not have had in the past. So
yeah, yes. I wanted to say, Angela, like your name definitely like travels around just because you've done such a good job with networking, but in doing like the interview series that I have been doing for Voices of Recovery and the different stories, both with families and those that are in active recovery or in, you know, going through like the motions and such, your name does get brought up quite a bit, and this program has definitely, I think, been such a supportive outlet for people that was just new. I think one comment was the biggest barrier was getting to like the emergency room in crisis and actually getting the medical help and like feeling human when they got there and not so much like a statistic or a number. So I wanted to say like that's so huge, but it's been brought up so much. And I think like a lot of people, what you're doing, a lot of people talk about Pine Lodge a lot, and just the piece of somebody held them accountable, but in a sense like also showed them their worth, in a sense like they're broken down just to see what that is. So I wanted to say like it's awesome what you guys have come up with, and it's unique, but it's needed kind of just given our wait times and everything. So I really commend you guys doing that.
Oh, thank you. Well, and I think, you know what, it really just, you know, it's just providing that non-judgmental outlook as well. I tell many of our clients, because I still work as a community paramedic in this program, is we all fail in life. And what defines us is how well we rise every time we fail. And that is just part of everyone's journey in life. And so just because they are struggling today with addiction, everybody does fail, you just may not see it. And so it's just providing that non-judgmental and just kindness. Everyone just needs kindness.